As you can see, the past few months have been relatively busy for us. From August onwards, it's been busier and busier. And then in November, we hit triple figures. And that's the first time in the hub's creation where we've had triple figure referrals come through. And then in December, and I'm pretty sure it's because of Christmas and silly season, that the numbers went a little bit lower. So it was on 87. In terms of organising it by cumulative by employer, as you can see, lots of different employers there. And we've also tinkered with the data and included primary care as well into this. We try not to share anything under 5 purely because it could be identifiable information for staff members who have referred into us. So as we can see, the biggest referrals we've had are from Liverpool University hospitals and also Merseycare. And there was a lot of stuff with Liverpool University hospitals with the new hospital, the merger from the old to the new. And we're currently working with the team behind Luft to get a regular spot there to look into any issues that we might have coming up. And then also Merseycare, because Merseycare is absolutely huge across the whole patch. They don't just cover Liverpool, they cover everywhere else as well. And then it goes down in numerical order. In terms of organisation by employer, for the last month, you can see that Merseycare had the highest amount, and also Mid Cheshire hospitals following, as well as Liverpool University hospitals. Then with St Helens, Wirral and Bridgewater, again, anything under 5, we do have that data and we can let you know one-to-one, but we don't share it in the forum like this, purely for IG reasons. As we look into roles, currently where we are, apologies, I've not put the actual figures on there, the numbers. I'll get that sorted when we send the information out. But you can see in terms of the numbers of referrals coming through the hub, and we try to break it down from a clinical aspect right through to non-clinical roles at the same time. There is a section on there where it's other, or it's usually called missed, and this is where people haven't put their information on, but we still like to count that data as well. So that's the clinical aspects of the hub in terms of the breakdowns, the numbers currently where we are. And we also offer non-clinical interventions at the hub, and one of that being is relationship support. Now, currently in terms of numbers, I don't know what's happened in September, but from September to December, it was a massive increase of people coming forward for relationship support. And this isn't by us, this is via our partners at Relate, who we pay for that service. We currently have, I think I've read earlier on, 34 cases left. So we've extended the contract twice this year with Relate. It was meant to finish May last year, and then got extended to December. And then from December, we've extended it again till the end of this financial year. So we've only got 34 cases to last, which I think will last. But like I said, the numbers are getting higher and higher. And this is something we're looking into as we go forward. So just a little bit of a breakdown in terms of what we've been doing with the hub, how many people have been assessed, and also the non-clinical assessments that we've done as well. So we've had 11 nurses and midwives come through and been assessed. Doctors and consultants is 3, managers and leaders are 2, and non-clinical roles are 16, and other clinical staff is kind of social care as well, mixed in together, and that's at 20. And Judy, who's the eyes and the ears of the hub, she's like the human version of the CAB, has undertaken 5 pathway support roles, and this could be around housing, debt, finance, social integration, addiction, domestic abuse, anything like that we can help with at the same time. So we also report on them numbers. Does anybody have any queries or questions? I can't see the chat. I can't see people, by the way, so bear with me. Chat. So yeah, if you've any queries or questions, please do pop it in the chat. Yeah, that's that. So way ahead of time. However, I'll pass over to Lucy, do you want me to continue sharing my screen, Lucy, or do you want to take over?
No, that's fine. You can, I don't need to take over anything, but you can stop sharing because then you can be part of it, Lee, if that's helpful.
Real, thank you.
No worries. Yeah, just hi everyone. So I'm Lucy. I'm one of the principal clinical psychologists in the hub, and I am the clinical lead for our assessment pathways. So the one-to-one assessments where people can self-refer and come in, and we can kind of think about maybe what their needs are and what's going on for them. And I guess what we're in a position to do now is try and support kind of our signposting and thinking about how we connect with other services. And we've started rolling out a sort of champion role among the clinicians. So I suppose this is kind of complementing the work that Lee and Judy do in terms of outreach and engagement, but more from that angle of kind of the clinical offers of the hub and where we can fit people in and where we think about services that might best meet their needs. So I just wanted to say that we have kind of rolled that champion rollout within our IAP services, so our kind of primary care mental health services in our patch. And that's why it worked quite well, just to have that link person to kind of discuss and compare things like waiting times for intervention, perhaps, to kind of think about what's most suitable, client suitability for a service, if that would fit with their needs, etc. So have that kind of close liaison in some of the cases that we see. Because that's worked well and we can kind of see that model being quite helpful. We're looking to roll that out, looking at our kind of, first of all, our NHS staff support services at this point. So as Lee showed from the stats, we know kind of who are sort of where people are in terms of the positions that they work in and where they kind of work. So we're going to focus on developing that champion role with our kind of staff support and wellbeing services within NHS settings. That's our next step. So I just wanted to kind of say that was on our agenda. We're really keen to kind of have those close ties to be able to kind of understand each other's waiting times and where the client might get the best service from, really. So we're just pulling some information together, and we'll have our champions be in touch with your services kind of in the next few weeks, really. And it's just that chance to kind of have a more regular check-in. And if you've got any questions or you think someone might be suitable for the hub, you've got kind of a clinician that you can kind of contact to check that out with as well. So it's just to flag that and say hi. And yeah, our clinicians will kind of be contacting people quite soon. So we'll be looking at staff support and kind of wellbeing services within NHS settings at this point. I guess if there's anyone else that's kind of not falling under the IAPT or staff support umbrella, but you think it would be really, really helpful to have a link person at this stage, then please do, I guess, get in touch with Lee. He can pass on your details and we can look to arrange that sooner rather than later. So I'm aware we've got kind of maybe third sector, ambulance, police, fire, things like that might also be on the call. And that's it. But if anyone's got any questions or wants to know a bit more, feel free to fire away.
Real, thanks, Lucy. Does anybody have any questions in regards to Lucy's NHS champions? I know that we don't have representation from the police and also the ambulance on, but I'll also share this information out to them and also send a video as well, because it'd be good for them to get involved. I know they've got a lot going on, but it'd be good to see where it is that we can support as well. Real, thanks, Lucy. Smashing. Right, so that brings us to you guys then. So we're currently with, apparently it's saying stop sharing, but I wasn't sharing, so bear with me. I'll also bring the presentation back up. So that brings us over to you guys. When we're talking about wellbeing plans, talk about where we currently are, and all the sort of stuff which is currently in the calendars at the moment. It's a fresh year, so what have you got going on? What's the plans that you have scheduled for 2023? I'll give you a bit of an insight from the hub. We have lots currently happening, lots of partnerships, workings being created, pieces like clinical interventions and also non-clinical interventions, and also tying services together. So I know we've got Roberta here, we've also got Danny, from Merseyside Sport and Active Cheshire, is it? We've also got health and wellbeing leads as well, and we've also got assistant psychologists from different organisations. We're trying to, as the hub, what we're trying to do as we go forward with our outreach aspects is have a set plan for these. So we're going to be continuing doing outreach as we go forward. It's going to be a little bit scaled back because we're going to be doing it on a Wednesday, Thursday, Friday. There will be opportunities through the week where we'll be doing outreach on a Monday and Tuesday as well, but we're trying to engage more people and have a presence, a regular presence at different organisations. So over to you guys. Does anybody want to start with what they've got going on for 2023 in terms of staff wellbeing? There is a message in the chat. Okay, bear with me. Oh, Kathy, thank you very much. So Kathy's just mentioned here from Countess of Chester, they're hoping to progress with support for the menopause, and she's currently in the process of developing a support group. She's also been in contact with, sorry, it's just moved, with a menopause educator who was on the BBC News, and this lady delivers workshops for groups of 12. That's really good, that. And also, I know how hard it is, because what we're doing at the moment is we're looking into our workshops, our workshop offers, and one of the workshops what we're looking at implementing is kind of like a webinar and across and Liverpool Women's in terms of menopause support as well. So if there's anything you need, anything support wise that we can send over your way, Kathy, let us know. Or if you want to link in with the clinician on the workshops, I'll happily link you in and share best practice around menopause.
That'd be great. Thanks, Lee.
Yeah, not a problem. As we're talking about menopause just isn't for women, although it is predominantly women who are going to experience the issues and everything, but also men still experience these issues in the workplace about supporting the colleagues at the same time. So what we're trying to do is a big rounded approach and also integrate people. Sophie from Mid Cheshire has said they've done lots of work regarding menopause. I'm happy to put you in touch with a menopause lead if you think that'll be helpful as well.
Yeah.
Do you have Sophie's contact details, or would you like me to share them with you?
Yes, please, Lou.
Well, not a problem, will do. Jill, I'll go over to you.
Hi everybody, I'm Jill Jolly, I'm from Bridgewater Community Healthcare. So I'm sort of like transitioning into different roles here. So as of up to now, I am the staff engagement lead within the trust, but as from Monday, I go into the OD practitioner role for health and wellbeing. So I think when we look at the wellbeing plans going forward within Bridgewater, I think what I'd be really keen to do is really engage with staff and look at what we offered staff throughout 2022, and really did that tick all the boxes that staff wanted. Because if there's things that we had last year that didn't work well, staff didn't engage well with it, then do we need to do something differently this year to get staff on board, or do we need to do it at all? And it's about really listening to the staff and looking at what is it that the staff want, alongside looking at the the health and wellbeing plan, and really seeing where we can see where the gaps are within that. So I think that will be what I'll be sort of like focusing on over the next couple of weeks, into a month's time, looking at really what we did do, and will that work for this year, and what new things we can put into place. So it is still quite draft format, but it's looking at, are we listening to what our staff are asking for?
Yeah, I totally get you. I think that's the same what we're doing. We're currently looking at, instead of just doing outreach for the sake of it, is looking at the organisations that are coming through, utilising that, but also the organisations that might need a helping hand, more presence from ourselves. But I just want to also touch on that point as well, where you've just mentioned about looking into what you've done previously and has it ticked the boxes. The embargo for the staff survey is due out relatively soon for organisations, and we work closely with NHS North West to understand all the organisations. And obviously we can't act upon it or say anything until the embargo's passed, but we link in with these organisations to say, you're under percentage at this or that, and we can work with you to get more, say, interventions free, be that a team intervention or be that one-to-one interventions, and having more of a presence on site as well. So once we get that information come through, I'm more than happily linking with organisation wellbeing leads, OD leads, that sort of stuff, to create a bit of a plan. Like I said, as we go forward, we're trying to get a monthly presence at organisations. We are bringing our assistant psychologists back on outreach as well, so they'll be running, say, basic listening type rooms within the organisations, so we can actually have a hand-in-hand approach to health and wellbeing teams and the hub as a whole. But yeah, thanks, Jill. I really appreciate that. If anybody else is doing anything similar to what Jill's doing over at Bridgewater, do let us know. I'll pop it in the chat. I can also share your details with Jill as well, and learn from best practice. Brill, thank you. Danny, hello, over to you.
Hi Lee, you all right? How you doing? Hi everyone.
Yeah.
I've recognised quite a lot of names in the chat, but for those who haven't met me before, I don't know what we do. My name's Danny. As Lee said, I work for MSP, so we're the active partnership for the Liverpool City region, and Roberta, my counterpart in Active Cheshire, is here as well. And collectively, we cover the whole of the 9 places that make up the Cheshire and Merseyside ICS region. So if you don't already know, we work at a strategic level to promote sport and physical activity. And last October, we launched a physical activity strategy for health and social care for the region, which is called Altogether Active. I can pop the link in the chat for those who haven't seen it. So specifically, there was kind of a couple of things that I wanted to mention related to staff health and wellbeing and physical activity. And then a couple of things that are kind of more staff development related, but it'd be good to quickly squeeze those in. So some of you might already be aware of these, but just a recap for those who aren't. So the first one is the NHS Games, that I know quite a lot of people here have already got their trust signed up. So I think we've got about 15 or 16 trusts now from across Cheshire and Merseyside that have signed up, so the vast majority. And essentially it's a free offer of lots of different activities, sport competitions that staff can get involved with completely free of charge. They're across the whole Cheshire and Merseyside patch. But really importantly, they're designed for absolutely anybody to take part in. So you don't need to be sporty, you don't need to be active to take part. The whole emphasis of it is that it's inclusive, it's designed for people to come together to improve their health and well-being. It doesn't matter who wins, it doesn't matter if you're good or not. So I know a lot of the people on this call are in the steering group of that. And the dates, all the dates and venues for the 2023 events are going to be shared within the next week or two. Hopefully they'll be coming out. And we are running a step challenge at the moment as well for staff to get involved with. I'll paste the link in the chat just with like where you can find out all the information, which trusts have signed up. But it'd be great just as part of this group to help raise awareness of that within your own trust and within your own teams. The second thing quickly just to mention is about the NHS Prevention Pledge. And I know that different trusts are at different stages of engagement with that. So some have been on board right from the start, and I think it launched maybe about 2 or 3 years ago, possibly. And I know there's quite a few trusts coming on board as part of the phase 3 tranche that's going to be I think within the next kind of couple of weeks or months. So just a bit of a heads up for those who haven't already been involved in that work, that Roberta and I will be engaging with each trust across the patch to see how we can use physical activity as a way for the trust to demonstrate their commitment to the prevention pledge, but also obviously using it as a way to improve staff health and wellbeing as well. So I thought I'd quickly mention those two. And then the two other bits that are kind of more workforce development related rather than staff health and wellbeing. So one is that through the Altogether Active strategy, we have an online resource hub that contains loads of information about how to be physically active in Cheshire and Merseyside. So if any staff want to know for information that they can pass on to the patients, or just for their own learning and development, awareness of what's going on across the region, again, I'll pop the link, or Roberta might pop the link in the chat for that one. And the last one, and sorry to put you on the spot, Roberta, but I was wondering, did you want to do a quick MEC update?
I was just about to come to you, Roberta.
Yes, we delighted to share some good news that we've received joint funding with the Royal Society for Public Health to develop a module of MEC for physical activity. This is, I can see lots of people talking about menopause in the chat, so you may be aware of the MEC for menopause module. This is the MEC for physical activities, a similar format. The funding will cover a small pilot across Cheshire and Merseyside. We hope to deliver the training to 35 colleagues within the health and care system. And this could be social care or healthcare. And these are people who have those conversations with members of the public about behavior change. But I don't see why it couldn't be somebody who works in OD or works in staff development. I have that conversation with members of their team who actually need to be more active and understand what physical activity means, which isn't wear lycra and run a mile. So that's all. So if anybody's interested in understanding more, and we have a focus group, but we also have the opportunity for people to feed into the content of the course, and as well as being part of the pilot themselves. So actually receiving the training and feeding back on the training. It is going to be independently evaluated, and then once the course is finalized, it will be available on Future NHS with all the other MEC training.
Well, thank you. He was on my list to actually get some information about as well. Danny, I just want to come back to you and touch on some of the points that you've mentioned there. You said about the NHS games. Now, last year we wasn't really instrumental. We just published it in our newsletter and on our socials. But do you have any like physical leaflets that we can actually take out to our outreach events?
Yeah, so we've got for each individual activity. So we do things like we do things like a run and a walk and cycle rides and football and netball and badminton around. There's a whole range of stuff. So we've got individual posters for each of those activities that's got the dates and the times and venues. And then we've also got kind of like a generic NHS Games poster as well that can be used. So yeah, we can circulate those when they're ready.
Yeah, perfect. Because I can, for those who aren't attending today, there's a wide range of health and wellbeing leads across the patch. I can also circulate all that information to them, and as well as include it in our social medias, that sort of stuff. Our newsletter reaches about 1,000 people, so hopefully we can include that sort of stuff. The same goes for you, Roberta, in terms of any MEC paraphernalia that you might have. Any information, leaflets, that sort of stuff, let us know. We can send that out. But yeah, you've got your hand up. I'll go to you, Roberta.
Just a second thought. It happens with the menopause, things sort of jumbled up in your brain and random orders. We were wondering, I'm using the royal we, whether all of the NHS staff, and I know there's a million of you, use the same platform for their training. Where is that like staff training hosted on a communal platform, or does each trust and each organization use their own?
It's a cost aspect, so it's usually, so for example, we sit within Merseycare, but we're not Merseycare ourselves, but we utilize Merseycare's training packages. So every organization will have a different platform part of the aspect. I don't think I've ever heard of it as a shared perspective, but it's something that could be shared out. I mean, I've got some stuff I'm trying to send out at the moment about an e-learning module around debt help, that sort of stuff that OD
Yeah.
leads can actually implement and put on their
Mm.
systems. But it could be something, we'll ask the question. I'm going to be
Thank you.
sending out a some information to all the partners, just asking, say, about this meeting, does this meeting work at this time, so on and so on. So we can also ask questions like that at the same time to help.
That would be very helpful. Thank you.
No, that's all good. Like I said, if you've got anything, anything physical that you want us to take on outreach events, let us know. Any digital leaflets we can put in our newsletter and on our socials, and also send it out as part of the hub update as well. Jill, you had your hand up and then you put it down.
Oh, I did, because I didn't know whether I was giving you false information or not. So I thought I was like, I think I've got a feeling with training that if you speak to, regardless of what training package it is, if you speak to the trust, like education team, they can put it onto their, onto their training sites, because I know for our health and wellbeing and staff engagement champions, we've managed to import some of the national training packages onto our ESR training, so that staff can go on and access it that way. So, and like I say, that this might be completely false information, so I apologize if it is, but I've got a feeling that internally the training education and training team can put it into their
Yeah. Thank you.
own internal side of it.
Thank you, Jill. It's no, it's really useful. And if I may, I'll ask you a question back. Since you added your training to their platform, are you also going to be able to see how many people access the training and complete it?
Yeah, so so for example, the one that we've added is the health and wellbeing champions training that's being run from a national point of view,
Mhm.
and that's being offered out to all our champions. So I can get like a report off
Okay.
from our training department that'll actually say, how many staff have completed it and who's completed it.
Okay.
And it's not so that I can, tell people off for not completing it. I suppose it gives you a frame of, is this training, are
Useful.
people accessing it? Are they
Of course.
finding it useful?
Yeah.
Is it having the reach that you're wanting it to have? So yeah, to your answer, yes, you can
Thank
pull
you.
off that.
Thank you.
I think as well with what you were saying there, Roberta, in terms of say staff development, staff training, that sort of stuff. With the NHS, it's kind of everything's all there in one place, but also social care also falls part of the NHS people plan. And I was in a registered managers meeting yesterday, and they were talking about learning and development. And they're so far behind in terms of, like, say, platforms or all of this. So if it's something that I could facilitate and linking in with social care sector, I'm not promising I can get you results, but I can try and link you in with relevant organisations, be that one-to-one specific or in a group or in a meeting type thing where you can share that. I can try send that as well if that helps.
Thank you, Lee. Anything helps. Every little helps.
I'll also link you with the police and also the fire, because we represent them. So I don't know whether they fall within your remit as part of frontline workers or not.
I'm not sure.
But it's something, if it is something we can explore, and if not, then can always ask for further advice if needs be, and that as we go forward.
Thank
Brilliant.
you.
Does anybody else want to tell us about the wellbeing plans? Chloe, I'm going to come to you. Tell us about this. Tell us about this lovely little room. No. Well, over at Liverpool University, hopefully Chloe comes back in a second, but over at Liverpool University Hospitals, they've just moved into their new building, and their new building is huge. So I don't know if anybody's seen it. It's massive. Judy's saying it's sparkly, it's gleaming, and they are getting a wellbeing room and a brand new wellbeing room, which is more fit for purpose. And they've just put a bid in to the hospital charities, and this is going to be on the 9th floor, I think, so it's more central, and more staff can access it. When you do hear this, Chloe, give us a shout and I'll let you talk about it. Does anybody else want to tell us about their wellbeing plans for 2023 and how we can integrate?
No, but that room makes me very jealous.
I think, do you know what, it's been, we've had a regular occurrence with Liverpool University hospitals because we started a clinical intervention which turned more into an outreach aspect, and more so for the past few months we've not been doing much outreach there because of the big moves, all of that sort of stuff. And then I found out about this by doing some outreach over at Aintree the other week, and they were telling us about this room and about the funding. But yes, so, but on also that note, in terms of like staff aspects, I saw whilst having a browse on Twitter yesterday that the Skills for Health awards are actually happening soon. The nominations are currently open now and they close on the 20th of February. And they have categories for health and social care, and I'll send a link out. I'm just trying to get the link for you now. But basically, it's an opportunity to recognise your staff whilst you have your own internal awards. These are Skills for Health awards, and they incorporate health and social care as one. And there you are. Pop that in the chat. So if anybody want to put a bit of PR on that with people. But if anybody wants any further information with that, contact the team, get them on Twitter. They're really helpful and really informative. Jill, Kathy, you've got your hand up.
Yeah, it was just regarding the wellbeing room, which is also top of our agenda stroke dream, because we want one too. We've been trying to push for somewhere, anywhere, just to have that space. I think it's so important for people to have that space, as well as it would be an opportunity where we can include services like yourselves coming in, like the CAB, like Step Change, coming into the room and giving talks and information out, really. Also, across the hospital, quite a few of our wards did food sharing and food cupboards, and that would be another opportunity in a wellbeing room to have that kind of space to do that.
Two things I want to ask you. How did you bypass the red tape with a food cupboard, food share type thing? Because I know Rachel over at Liverpool Women's was wanting to do something like this, like a cloth swap, that sort of thing as well, and was met with barriers galore. So any insight you could share, happily I can share out to other people as well.
Yeah, and I can't take credit for it because I would have come across all that red tape too. But I think these departments took it upon themselves to ask for forgiveness rather than permission, and they did it amongst themselves in a very low-key way. And they seem to have got away with it.
I honestly love that motto. It's something I've abided by whilst I was at uni. Ask for forgiveness, not permission. Get away with stuff. The other aspect is also linking into what you're saying in terms of wanting space, wanting a room. So what I said to Sam over at Liverpool University is hospital, sorry, should say hospitals at the end, it's not the university, is that if we can provide a business statement, a case for the need for this, we can look at our numbers from a systemic point of view, how many systemic interventions you've had, we can have one-to-ones, that sort of stuff, and why it's important for staff wellbeing as a whole, and we can support that business case for you guys. And we could put something in writing to the powers that be, talking about the benefits of a staff wellbeing area. It's not only
that would be really helpful, Lee. That would be great.
Yeah, and the same goes for anybody else, whether you are health, whether you're social care, whether you're emergency services, and you're trying to look into staff interventions type spaces. Let us know, because we have, like I said, we've got with NHS England, so we represent the ICB, but we don't work for the ICB. Sorry, we work for the NHS as a whole because it's part of the people plan. So if there's anything that we can do in terms of data, trying to find data, and it's also bringing stuff together, say analysing things from, say, the staff survey results last year to this year, where we currently are, and how we can implement that. And it's not just a space where it's going to not be used. It could be whatever you want. I was watching a TikTok the other day, and a nurse can't stand white walls, and she's an artist as well. So she paints all these murals on walls and stuff, so it could be as fun as you want, or it could be as clinical as you want, and so we can help support that sort of thing as well. But I'm not making notes, but I will listen back to this video when I edit it and put the logos on and make some actions and be in touch with people with anything else. I don't want to pinpoint people, but also I don't want to force people. Jill, you've got your hand up.
I am sorry. I feel like I'm keep on talking here, so
It's all right.
apologies.
It's a short meeting.
When you talk about the health and well-being and staff spaces, I think this is something as from a community trust that we really struggle with, because we're such a wide geographically dispersed organisation, with staff that literally zip into the office and then they spend all day outside of the office. And I think that's something that I would really like to look into. And so I think when you come to do that paperly, if there's any way of squeezing in there about community services, and because I think I would love to be centralised, Kathy, just like yourself, and we've got a space where all staff can come to us, but unfortunately our services run, we're based in Cheshire, got services right up to Oldham, and sometimes we can't reach them due to weather conditions. So I think it's really important that we remember those community services as well.
Yeah. What I'll do is, because it's trying to predict the future, isn't it? In terms of, say, community healthcare and understanding the needs and the wants and that sort of stuff. But I'll link with the partners to understand like the community-based partners to understand what it is that they're doing in their health and wellbeing efforts. And I'll put the question to them: is how is it that they've got bypassed that they've got past this? And I can share that information with you. But yeah, when we come to, I think once it's linking in. Do you know Jude at the Northwest team? Jude.
I haven't linked in with her yet because, like I said, I don't actually start this role till Monday, so I'm sort of like
Pre-planning.
I'm sort of like pre coming into this. But
Mm.
I suppose these are the people that I'm gonna be linking in
Yeah.
with.
Well,
But if you can send me a contact, Lee, that'd be
I'll
really
introduce
good.
you, and then it might be worthwhile also picking this up, the national team with Karen, with Jude, and everybody, because whilst they need to understand this perspective, because it's all well and good talking about health and well-being, and it's the same with this meeting as well. With say with social care, a lot of social care feel pushed out, but actually how can we integrate our services? How can we have a shared approach? And it's utilising stuff like, say, Roberta and Danny in terms of the making every contact count, the sport aspect, the integration aspect, and sharing best practice as well. So not to leave you out, what I will do is definitely put the question out to people and just say, what is it in a community-based approach that is being done? And I'll share the information with you. And I'll also link you in with the national team as well.
That'd be great. Thank you.
Brill, thank you. Does anybody else want to let us know what they're doing for 2023? Or if not, we will bring the meeting to a close. No? Okay, brilliant. Well, just to let you know from the hub perspective, we're here, we're continuing. I've been creating a range of partnerships with different organisations, Step Change being one of them, and I've emailed a lot of you already about the referral form. As an organisation, you can refer staff members who are having troubles with debt to Step Change, who will help and get call-off orders in place. Completely free service. We've done all the legwork for you. And I'm currently doing it for Manchester and Lancs as well, because they also don't have a me. So if I can just get this sorted, just send them the link. That's sorted. We have lots of partnerships up and coming, and we've got some campaigns coming up. What I'm going to be tapping into you guys, because I want you and your trust to be part of it. But I will let you know about these as we get to them and get planning. Thank you very much, everybody. The next meeting is, I think it's definitely going to be in February anyway. I know that. It is on the 24th of Feb, same time. I'm going to be sending out information to partners about a bit of a partnership scoping exercise. I will send this video out as well, and anybody who wants any further information, please do contact me and let me know what you need, and we'll see what we can do. But like I said, I'll be in touch with you trying to get a regular appearance at your organisation. Thank you very much, everyone. Have yourselves a lovely day.